So thumb forceps will be useful for the clearing of the external canal and the nose and etc. Next comes to Freer's elevator. This is optional. You can use a Freer's elevator, and if you want, you can use a Freer's elevator in your keep in your instruments tray. The why I kept here, it is optional. You can use this for the again the pushing of the gauze pieces, ribbon gauzes and all. You can clear, and you can completely push inside till the nasopharynx, and you can clear the synechiae and crusting with the Freer's elevator, which are used. Now everything is ready. The patient is in front of you. First you should ask the patient about complaints, which are go in chronological order as per the undergraduate examination. Now for all other subject specialties, chief complaints are 4 or 5, or if you expect more, not more than 10. See, I am stressing this point again. If the other specialties, when you come to surgery, medicine, gynecology and all, your final year subjects, and so you may have orthopedics. Like if you go to any other subjects, that will be examination will be different and the complaints will be different. They will have some cough with expectoration, fever, like some swellings and all. Only you may have 3 or 4 complaints or 10 complaints, not more than that. But here in ENT it comes completely different. But in ENT it is completely different. Why I am stressing this word is, here we have in the ear, nose, throat, three are narrowed. I am again and again telling, narrowed tube-like hidden structures which are not seen with the naked eye examination. You need a headlight or bullseye lamp examination for the examination. So which are all have separately 4 or 5 minimum complaints. So here you may have 3 or 4 complaints, nose and throat, and in the first session, in the first thing I told, you have recently we were included with the ear, nose, throat and also head and neck. So including head and neck, you may have 1 or 2 complaints in the head and neck also. So again I am telling 4 or 5 minimum complaints for each structure or organ. So which are necessary to know as an undergraduate, compulsory, and in as a chief complaint in chronological order. These are I am coming one by one. Ear complaints. Ear chief complaints are, see, I told you, whether you remember 10 or 15, it's not that much important, but you need to know, definitely you need to know 2 or 3 minimum complaints which the examiners will expect, and you should ask the patient. So those are the one will be the ear discharge. It may be unilateral or bilateral. So we will come in the later sessions. What is ear discharge? What are the types of ear discharge? Why will be the ear discharge and all like that. So next will be the hard of hearing, and next will be the earache, and next will be the blockage of the ear or fullness of the ear. And the next complaint is the itching of the ear, and next complaint is the swelling around the ear or in the ear, or the swellings will be different in the ear. So in the upcoming sessions we will discuss about each and every complaint separately. So then comes to nose chief complaints. Nose chief complaints are, one will be the nasal discharge and nasal obstruction and the bleeding from the nose and the headache or facial pain, and next comes to swelling of the nose and sneezing, smell disturbances, etc. And the throat complaints are throat pain which is associated with fever and upper respiratory tract infections, and next come to difficulty in swallowing. Difficulty in swallowing is the main complaint of the throat. And then comes to change of voice, which is related to larynx, and bad breath, which is halitosis, and you have ulcers in the oral cavity or swellings, and pain during swallowing, which you call it as odynophasia. So in the order these complaints will be coming. And next I told you in the beginning, which nowadays we were included with the head and neck also. So head and neck related complaints are very little, but which are very important. Respiratory obstruction, you may need tracheostomy here. Respiratory obstruction is called as stridor. you may see in children, adults, and which are with the addictions. So we will come in the later sessions what is respiratory obstruction and all. Next, mass in the neck. What is the normal mass in the neck? What is the mass you expect in the anterior neck? Preferably, commonly will be the thyroid swelling. So here we will close this part 1 session.